Specialty Story, session number 35. Whether you are a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast will tell you the stories of specialists from every field to give you the information you need to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to the Specialty Stories. My name is Dr. Ryan Gray, your host here for this podcast, as well as many others on the MedEd Media Network. If you are a medical student and you know lots of pre-meds, because we all do, I think, then I would love for you to recommend the Pre-Med Years podcast to your pre-med friends as you are in medical school and they want to be where you are. You can recommend the Pre-Med Years. Just send them to mededmedia.com. That's MEDED media.com. Today I have a great episode for you today, learning all about pediatric ophthalmology. I have Dr. Chris Fecarotta on to talk about his role, his life as a pediatric ophthalmologist in private practice now for 5 years. I started the conversation with Dr. Fecarotta about why he ended up choosing pediatric ophthalmology.
I didn't know until fairly late in the game. I figured out that I wanted to do ophthalmology probably at the beginning of my fourth year. I always knew I wanted to do kids, so I went into medical school thinking I would be a pediatrician of some sort, but I didn't know exactly what. And I discovered as I went along that I really liked surgery more than I thought I was going to. And I discovered ophthalmology because a friend of mine had some family members that were in ophthalmology, and I talked to them about it. And I always thought that it was an interesting field. And so I put two and two together, and I said, oh, maybe I could do pediatric ophthalmology. And I shadowed a pediatric ophthalmologist and went into ophthalmology residency thinking that's probably what I would do. And I stuck with it.
What was it about shadowing the pediatric ophthalmologist that kind of said, oh, yeah, this is really cool. This is what I want to do?
Well, I liked the eye a lot. The eye is a very fascinating organ. It's a lot more complex than people think. It has very interesting, cool, intricate surgery at a very small level. I liked the very small surgery. I really liked the outpatient environment. I was not a huge fan of doing inpatient work, and so it fit all of those things for me very, very well. It also affords a reasonable lifestyle. There aren't that many emergencies in it, and you can really make a big difference in children's quality of life by improving their vision, and all those things are really what appeal to me.
What traits do you think lead to being a good pediatric ophthalmologist?
I think the most important thing would be to enjoy working with children. It's a very challenging field because children it's not the easiest thing to convince them that it's okay to examine their eyes. So you have to be able to work with them, be very patient, and have a very good rapport in order to get what you need done. So I think that's the most important thing, to be able to work well with children and to enjoy it too. If you don't enjoy it, then you're not going to be good at it. So I think those are the most important things. Other than that, I think it's important to be very detail oriented. In all medicine, that's important, but I think especially for ophthalmology, because it's a very, very small organ that we deal with, and it's fairly data driven, and so I think being detail oriented is important in the field as well. I think those are probably the two most important qualities that I think make for good pediatric ophthalmologists.
And being a surgical subspecialty and being such an intricate organ in the body, is that something that a student should think about, whether they have that fine motor detail, or is that something that you learn as you go through your training?
I think it's a little bit of both. I think there are definitely people who have a more natural ability to do surgery, especially small surgery. but I don't think that this is not something that can be learned. I think that it's very possible to learn it, and it's not something you need superhuman dexterity for. I think someone with normal dexterity can do it with dedication and practice. So I think there are varying levels of natural ability, just like with anything else. And there are occasional people who find that they just really are not cut out to do surgery. But that's rare. Most people can learn it, and they do just fine.
What types of patients are you treating?
I treat mostly children with strabismus or crossed eye, lazy eye, amblyopia. Those are the bread and butters of pediatric ophthalmology. Nasolacrimal duct obstruction. So I see all age ranges. I see premature babies who have retinopathy of prematurity, all the way up through the young children who have strabismus and amblyopia and need glasses, to teenagers who have or continuing their eye care. And I also actually treat adult strabismus. Pediatric ophthalmologists also generally treat adults with strabismus from a variety of causes as well. So I treat all age ranges, although it's mostly children.
As a private practice doc, describe a typical day.
I would say I get to the office between 8 and 8:30, and I see patients through the day. I don't typically take a full lunch. Sometimes I can get a lunch, but often not. But I can usually sneak food in between patients. And I'm generally done between 4 and 5. And I do take call, but call is generally not very demanding. There are eye emergencies, but there's not that many of them. And usually most things can be triaged and then seen the next day. So it affords a reasonable life.
What would be an eye emergency where you'd have to go in?
An injury where the eye is ruptured, so we call it a ruptured globe. If the eye is cut and the contents of the eye are exposed, that's an emergency. That usually needs to be repaired that night surgically. Another eye emergency would be a retrobulbar hemorrhage, so from an orbit fracture or a trauma to the eye. If there's bleeding behind the eye and in the orbit, it can cause a compartment syndrome that can compress the optic nerve, and so that needs to be decompressed, and that's another emergency. Angle closure glaucoma, I would say, is another one, but that doesn't happen in children really, so it's not a pediatrics problem. But in ophthalmology, it's one of the other few emergencies. But that's really it. There's really not much else that needs to be seen emergently, so most things can be pushed off till the next day.
For you specifically, and this is very person specific, but you're in private practice now. You do have some academic background as well. What was the decision for you to move to private practice and get out of academics?
For me, it was more of a personal decision. So I got offered the opportunity to work in this practice by a friend of mine who owns the practice. Graduated the residency with him, and my wife is also an ophthalmologist too, and he had the job available for both of us. So it was more of a personal decision than anything against academics. I think both academics and private practice have upsides and downsides.
Okay, very cool. You as a surgeon are seeing patients in an outpatient setting most of the time, as most surgeons are. What percentage do you think of patients that you're seeing in the outpatient setting are you actually taking to the operating room?
A small percentage, 10 to 15%. Most of the patients are not surgical in pediatric ophthalmology. In general ophthalmology or adult ophthalmology, that's not true. There's a very high percentage of surgical patients there because adults mostly are there for cataract surgery, and pretty much everybody, if they live long enough, gets a cataract and needs surgery. So the volume of surgery for pediatric ophthalmology is less than general ophthalmology.
Okay. And you've already talked a couple times about kind of work-life balance, and you think pediatric ophthalmology provides that for you?
Yeah, yes, absolutely. I think it's one of the most ideal fields for that. If you like surgery and you like children and you want a reasonable life, I think it's a great choice. There's also a big need for them. There's not that many pediatric ophthalmologists, so
Okay.
it's pretty easy to find a job, and it's very rewarding.
What's the training path to get to a licensed, ready to work pediatric ophthalmologist?
So you have to do an ophthalmology residency, so that usually entails doing an intern year. Most people do a transitional year, but you can also do a medicine year, or some programs will let you do a pediatrics year if you want to specifically do pediatrics. But you can do any of those. Then you have to do ophthalmology residency, which is 3 years, and then a fellowship in pediatric ophthalmology and strabismus, which is 1 year after the ophthalmology residency. So it's 5 years after medical school graduation.
Okay, so not too terribly long.
No, it's not as bad as other surgical fields.
Yeah. Is matching competitive for pediatric ophtho?
Ophthalmology is competitive to match in out of medical school, but pediatrics is pretty easy to get a fellowship in. It's not a very popular fellowship, and so there's open spots usually, and most people can get a spot if they want it.
I'm going to assume that it might not be popular because of what you mentioned as far as surgical load. Is that why you think maybe? Because it's less surgery?
Yeah, that's definitely part of it. There's a couple reasons why it's not as popular. One, I don't think most ophthalmologists go into ophthalmology looking to deal with children. I think I was an exception, but most are not that thrilled about seeing children and didn't go into it for that reason. So that's one strike off the bat right away. Children are much more difficult to examine than adults, and so it's challenging. And so I think a lot of people are intimidated by it, or don't want to deal with the hassle of examining a child. So that's another reason. It also pays less a lot of times than general ophthalmology. For a variety of reasons. The one which you mentioned already is that there's less surgery, just because the field is less surgical, and a lot of children are on Medicaid, and so the reimbursement for pediatric ophthalmology is not as strong as for general ophthalmology. So I think all those things discourage people from choosing it. But if you like children and that's what you want to do, then I think that it's a great field to choose, and I would still encourage anyone to do it who likes kids.
What should a student be doing to be competitive for ophtho? And I guess for pediatric ophtho, it's not that competitive. Now, you specifically mentioned that you didn't realize ophtho until later in the game, which I would assume is harder because ophtho is so much harder to match in.
Yeah, I think like all the competitive fields, the most important thing to do is do well in your classes. The next most important thing would be to do well on USMLEs. I think those are the two most important things. And then after that, I really think that it's your letters of recommendation that get you in the door to an interview, and then having a good interview where you're likable and people can see working with you for 3 years. I think those are the important things. Things like research and that stuff that helps, but it doesn't. I don't think it really makes or breaks anybody. I think it's really you get your foot in the door by your academics and your letters of recommendation, and then your interview is really what seals the deal.
How important was the sub-I when you were going through?
I mean, I matched at a very good program, and I didn't do any sub-Is, so I didn't feel like it was crucial. But if there's one place that anyone has their heart set on, I don't think it's a bad idea to make yourself known by going there and doing a sub-I. But you better make a good impression, because if you go there and you don't, then you've pretty much killed your chances of going there. So
more harm than good.
Yeah, exactly. So you better make an A+ impression, or else you actually probably hurt yourself.
As an MD practicing in the field, do you see any negative bias towards DOs that are trying to be pediatric ophthalmologists?
I think it's challenging for a DO to get an ophthalmology residency, but it's not impossible. There are definitely DOs in ophthalmology. There are specific DO ophthalmology residencies. Mm-hmm. And so it's definitely possible. And once you're in ophthalmology, getting a pediatrics fellowship like I said, is not hard at all. So if you were a DO and you got into ophthalmology residency, that's the hard part. After that, you can do pediatrics if you want, no problem.
Okay. Once you're a pediatric ophthalmologist, are there any other opportunities to subspecialize?
Yeah, there are. You can do a second fellowship. Most people don't do that, but it's if you want to be very academic and you want to be the world's expert on pediatric glaucoma, you can do a second fellowship in glaucoma and do that. You could do neuro-ophthalmology and do pediatric neuro-ophthalmology. There's only about 4 or 5 of those in the country, but if you have that will help you out in as far as finding jobs and being an academic. So you can subspecialize within pediatric ophthalmology, but the vast majority don't.
Okay. What other specialties do you work the closest with?
I would say we often speak with pediatric ENT, pediatric rheumatology, and neurology, pediatric neurology. I would say those are the 3 that we're most in contact with.
Okay. I'm sure pediatrics is up there as well, obviously referring to you.
Yes. The general pediatricians also, who usually are the referral source for our patients.
For the future pediatrician that's listening to this and trying to get an idea of what a pediatric ophthalmologist does, what would you say, or what do you say to pediatricians to help them when they're referring patients to you to make your job a little bit easier and help provide more for the patient?
As much history as possible always helps. And I think most pediatricians already know to do that, and so I haven't had really too much of a problem with that. I don't think that most non-ophthalmologists are comfortable with the eye, and so I would encourage them to refer to pediatric ophthalmology if they're at all concerned about anything. It's better safe than sorry, and we're happy to see any patient anytime. So they should send it if they're uncomfortable, and you'll let us help.
Any go-to resource for the primary care provider to learn more about the eye that you would recommend?
Well, a good office manual is the Wills Eye Manual. It's WILLS. It's the most common manual of ophthalmology out there, and most eye providers have it in their office, and you can look up the different diagnoses, and it's a very good manual of how to treat them and what to use, when to follow up, and differential diagnosis, and what tests to order. And so I would recommend that everybody have that book in their office that they can use as a reference for anything they want to look up about eyes.
Okay. As a pediatric ophthalmologist, are there any special opportunities outside of the office for you?
Well, what can you give me an example of what you mean?
Well, for instance, an emergency medicine doc once said because they see kind of everything that it leads into hospital administration a little bit easier because they kind of know the rest of the hospital pretty well.
Mm-hmm. I wouldn't say there's that many opportunities like that specifically for pediatric ophthalmology. But if you're going to be an academic pediatric ophthalmologist, there's always good pathways to be a chairman. There's lots of research that you can do in pediatric ophthalmology, so there's good opportunities there. But I wouldn't say there's anything else specifically.
What do you know now about pediatric ophthalmology that you wish you knew when you went into your training?
I was discouraged from pediatric ophthalmology by other ophthalmologists who said that the pay wasn't very good, and and while it may be true that generally we make a little less than general ophthalmologists, I really wouldn't say that it's a reason not to do the field, because we get paid. I feel it's pretty reasonable. So I think I would go back and tell myself not to worry about that. If you like kids, then I think that you should go ahead and do it and not worry about the money, because the amount that you get paid is pretty reasonable. So I don't think that should be too much of a consideration.
What do you like the most about being a pediatric ophthalmologist?
Playing with the kids every day. It's a lot of fun. They're adorable. There's every day they say something that makes me smile or laugh, and that makes the whole day worth it.
What do you like the least?
The 5 to 10% of children who are very difficult to deal with, and I have to pry their eye open to get an eye exam.
Do you see any major changes coming to the field of ophthalmology, whether it's new medications, new technologies, or anything like that?
Yeah, there's some interesting things that are on the horizon. So there is a recent research has been focused on treating amblyopia with a certain type of iPad game that encourages stereopsis and using both eyes together to treat amblyopia. And so that's an exciting development in our field that I'll be awaiting to see the results. Also, retinopathy of prematurity is a disease that we commonly encounter, and there are some new treatment options in the last 5 years or so for that we're awaiting really good results from, and I think most people are excited about. And there's a lot coming around the corner. I think ophthalmology is a very exciting field for technology and innovations, and there's always new stuff going on. It's a very, very rapidly moving and progressing field.
If you had to do it all over again, would you still choose pediatric ophtho?
Yeah, in a heartbeat. It's a great field.
What last words of wisdom do you have as we wrap up here for a student who may be interested in pediatrics, may be interested in some surgical fields, maybe doesn't know anything in the world what they want to do? What do you tell that lost medical student out there?
Don't jump into making a decision. Take time, do rotations, and explore as much as you can before making a decision, because once it's made, you can't really change it. It's difficult.
All right, there you have it. Pediatric ophthalmology in a private practice setting with somebody who's had some academic experience as well. I hope that was informational for you if you are thinking about pediatric ophthalmology or any pediatric subspecialty for surgery. It gives you an idea of what is out there for you. If you have any recommendations for specialties that we haven't covered yet, and there are tons, but if you know somebody that you would like to hear on this podcast, go ahead and send them to me. You can just shoot me an email, ryan@medicalschoolhq.net. Hope you got a ton of great information out of the podcast today. We'll see you again next week here at Specialty Stories and MedEd Media.